Good evening, everyone. I'm Dan McKee, Lieutenant Governor, and welcome to Community Conversations. We're here every Wednesday evening at 7 o'clock, and we're talking about the most critical issues that that Rhode Island is facing because of the COVID-19, and also related matters that are important, whether they're small business issues, whether they're issues that have to do with our municipalities, whether they're issues that have to do with the Black Lives Matter and the effort to be to create a lot fairer policing strategies towards our different minority communities. We're here talking about these very important things, and tonight we're very fortunate to be talking about two main topics that are front and center. Has to do with nursing homes. And Scott Fraser, who's the president and CEO of the Rhode Island Healthcare Association, is going to be with us tonight, along with Akshay Tawar from Briarcliff Nursing Home. It's a 5-star award-winning skilled nursing home in Johnston, which I've had the pleasure of visiting, as I do many businesses around the state. During normal times and even during times like this. So we're very fortunate to have our guest, and also Deb Burton will be here tonight, and there's going to be a virtual broadcast tomorrow that I'm going to participate in, and Deb is with Rhode Island Elder Care, and she's hosting an event that has to talk about our veterans and everything to do with our veterans and all the resources that are available to our veterans. Deb is, I'll introduce Deb at the time, but she's very involved with all the issues that have to do with aging healthy in Rhode Island, and we're very fortunate to have her here tonight to give us a little preview of what's going to happen tomorrow. But I do want to just say specifically two things. One is we are hearing, and that we have kind of we're headed in the wrong direction. We're not critical at this point in time, but we got to put the mask on, everybody, right? You got to do the hand washing, and you got to provide the social distancing, and let's follow the rules in terms of how many people gather in one spot at one time. The governor is outlining a plan that is going to allow our economy to open up, but if we don't follow that, as we can see that we've already been targeted by New York and other states that if you head to Rhode Islanders head to New York, there's going to be quarantine issues that we're going to have to deal with. This is just common sense, everybody. All right, this is not politics. If anybody tells you it is, they're wrong. I'm on calls around the world with our International Economic Ambassador Program, whether it's in New Zealand or Australia or Taiwan or Japan or in Europe and Germany and England. Look, they're all on shutdown modes. They're all on areas that that we're impacting here in Rhode Island. We're not alone, and this is a worldwide issue, and we got to deal with it, with that urgency. And please, let's not say this is political in any way. I'm advocating for our small businesses and all the flexibility that we can possibly get for our small businesses. And we'll talk more about the grant program that came out this week. Next week, we'll be talking about that on our Tuesday call. But please wear your mask, wash your hands, social distance, and pay attention to to what the governor's office is saying, and also Dr. Scott. We only can make sure that we protect our health by doing that, and we also protect our economy at the same time. So that's my words of wisdom for my opening here tonight. But I wanted to, Ben, please bring on Scott and Akshay, please. These are two leaders in the nursing home industry. Scott Fraser, President and CEO of the Rhode Island Healthcare Association. Akshay Tawar from Briarcliff, which is an award-winning nursing home facility. And I want Akshay, just tell us a little bit about your facility, which I had the pleasure of visiting a few years back. And you have a broad, services there that are really highly recognized and recommended. And I know that you work very hard, and your staff does very hard to provide the services. But just give us a little introduction to Briarcliff, and then I'll have Scott introduce the role he plays as the CEO. CEO of Rhode Island Healthcare Association.
Sure. Thank you, Governor. Briarcliff is a campus with a skilled nursing facility that started in 1963. It's been there for a long time. It's a fixture in the community. We have 122 skilled nursing beds. We then opened up another building on the campus called Briarcliff Gardens, which is a memory care assisted living facility. And then we, in 2014, opened up another building, Briarcliff Cottages, which was a 20-bed, 20 private room memory care assisted living facility. And currently under construction on the campus is a brand new state-of-the-art 66 apartment traditional assisted living facility, which will be ready, coming online early next year.
Yeah, it reminded me of a resort, like when I was walking through there, and your staff was servicing at that level, and you know that our office is very involved with the memory care issues with Alzheimer's and dementia related issues. You know, we were able to get a 5-year plan passed last year in the General Assembly, and we continue to work in that area. But yeah, it gave the impression your high level of service and the campus that you described. Just give a little overview of your mission, the vision that you have, and why you're doing the work you're doing, Ashkay.
Well, as I've said in the past, the vision and the mission is to try and give the very, very best care for each and every person. I frequently tell my staff, everyone is a VIP, and that's how we treat each and every individual. The staff is infused with this great sense of compassion and mission, and we try and do the very best we can every day of the week. It's in the air. I think these folks, they do magical things. There's little acts of little tiny miracles taking place every day. And it's that true sense of heart that comes out when our caregivers are interacting with our families and our residents. So at the end of the day, do something good, do something for society, be a positive force, and everything else will take care of itself.
Yeah, well, thanks for being here tonight, because I wanted to kind of give that introduction, because the things we're going to talk about matter, because you have that vision and you have that caring, and that's why these issues matter to me and to Scott as the executive director, the CEO of the Rhode Island Healthcare Association. What I'd like to, Scott, I'm going to want to get into the impact of the COVID, the visitation issues, the things that we carried into this COVID with the UHIP and other challenges that the nursing homes have, and also the use of the current CARES Act funding. But before we do that, just give us an overview of your role as president and CEO, and the things that your members you represent for your members, and the type of advocacy that you provide.
Yes, Governor, thank you very much, and I appreciate you having both Akshay and myself on tonight. The Rhode Island Healthcare Association is a trade association that represents 64 of the 81 nursing homes in the state. All but one of the homes are for-profit. We have one nonprofit member. And the association really serves as the voice of all of these homes. We are their voice at the legislature, in public forums such as this, and we represent them collectively on a number of major issues. Obviously, in the middle of a pandemic, it has added to our to-do list, if you will. It has added a lot of representation that has been needed, because the homes themselves have been just flat out in caring for the residents and in doing their best to keep the virus out of their homes. So it's really important to have an organization that can serve as the voice of these homes as they go about their very important day-to-day business of caring for the residents and their staff.
Yeah, so thanks for that overview. I just want to remind everybody who's watching this live, and we know that that we'll reach several thousand people on this program, and so the messages that we're delivering are going to really resonate. And if anybody that's watching this, or either on the delay on the tape, that you can go to the Facebook or watching it live. If you have questions of our office on any related matter, related or unrelated, actually, that we can be of help during this time frame, you can contact us at 222-2371. So any of the issues we talk about tonight, we certainly can connect you into with Scott and with Akshay and as well, and the organization. And then also you can go to LTGOV20. Ben will put that up shortly at gmail.com. Our staff reviews that email site every morning, and then we answer every email that we get, during this time frame. So what I wanted to do was, let's just talk about with Akshay and Scott, please kind of weigh in together about and then we'll get specific about the visitation. But I just want to give us a sense on how this COVID is impacting our nursing homes, and what are we doing to really meet that challenge.
Well, certainly Akshay can give you some specifics of what it's like in the facilities. But Governor, I'll tell you, one of my overall concerns is the impact that this is having on the staff. This has gone on for months, as you know, and we've had so many hundreds of dedicated staffers in each one of our homes that come in and day out caring for the residents, and sadly watching residents that they treat as their own family members pass away. And this has gone on for months on end, and as well as putting their own safety aside, because there's concern of staffers of them contracting the virus as well. So my overall concern is that down the line, and probably in the not too distant future, I think we're going to have to really consider some help for the staff, for whether it's decompressing, whether it's mental health, whether it's I don't know what the answer is, but these folks come in, as I say, on a daily basis. They work their tails off, and they are totally devoted to the residents they serve. And at some point, it takes a toll, and that's my overall concern.
Yeah. So actually, you're living it day, and just give us a kind of an overview of, we didn't expect this, we didn't ask for it, we got a virus here, we're dealing with it, but it's having a tremendous, it's taken a toll, as Scott says, but it's also, your response is really should be admired in terms of what the services that we're providing. But give us your take on how this COVID-19 is impacting your facility and in nursing homes in general.
So let me take you back to about March, when this thing started taking over. COVID came into our lives in a significant way. Pretty much everyone in our industry, myself, my professional colleagues, we all said we are going to try and do the right thing. And what is the right thing for us to do? And we collectively put our heads together and we took action. We stopped new admissions into our nursing homes because we felt that every time we admitted someone, there was a potential of bringing COVID into our buildings. We utilized the screening tools given to us by the Department of Health. We started cleaning our buildings, and we were deep cleaning. And it was not just some staff, it was everybody. I would walk into the building and I'd see CNAs, nurses, after everything. We were using alcohol wipes. So the environment was, let's do everything we can to keep our residents safe. Unfortunately, the virus cannot be seen. We had very poor testing at the time, if any. And unfortunately, for a variety of reasons, one by one, different nursing homes saw the virus come in their doors. And I will stipulate, it's not because we did anything wrong. Nobody did anything wrong. We could not keep the virus out of the country. We could not keep the virus out of the state. We could not keep the virus out of nursing homes. We then endured. The staff endured, the families endured, we endured. We tried to take care of people. We then basically also were told, gee, it's a horrible experience, to be, if you're at a certain stage, let's see if we want to take comfort measures only for our residents and so on and so forth. So those discussions took place between our nurses and the families. And we found that, of course, we housed the sickest of the sick, 80 plus years old, multiple comorbidities, people who were susceptible to the virus. And yes, we cried. We cried with the families. We cried as we saw our residents pass away. We saw them suffer. And many of our staff suffered at the same time. So it was extremely difficult. We were traumatized. And I had nurses who felt it was their religion to stay there and to come again and again. They would leave, their shift ended at 3 o'clock. They were leaving at 11 o'clock at night and coming back at 5 in the morning. We had extraordinary dedication and extraordinary work done by all these folks. So we progressed through that. We saw more and more guidance coming out. We complied with it all. I think as an industry, we hurt. And it became a little bit more hurtful when we started seeing some insinuation that perhaps we had done something wrong, that maybe our infection control procedures were not appropriate, and maybe the insinuation that because we did something wrong, our residents suffered. And that is very, very hurtful, because everybody did everything they possibly could to safeguard our residents.
Yeah, so Oscar, yeah, thank you for sharing that. I think the personal story here is so powerful. It is just so powerful. And, the dedication that you described with your staff, I know that that's happening across the state of Rhode Island. And I'm not looking to turn the clock back in terms of like, what could we have done better? I'm really interested in what can we do better going forward. But Scott, you and I have had conversations, and it came off a call as a former mayor. I was the mayor of our town of Cumberland for 12 years, and certainly still very much connected in with our public safety and everybody that lives in the town and our nursing homes. And when I found out that we were not getting the PPE that we needed very early on, it was very disturbing. Our rescue staff was not getting the PPE. We have a nursing home in town that we had one of the very first virus cases, and we weren't responding. There wasn't a statewide response to that emergency in a way that I would have said, we really got to we got to really pay attention. And then when I heard that some facilities, if they got Medicaid, then they were getting stuff, but people who didn't have Medicaid weren't getting things. This was very disturbing again. But I know, just like I said, we're not here to beat anybody up, but at the same point in time, we need to set the table about how to move forward. And when we get into the back half of this conversation about using the CARE Act funds in a way that really matter to you, just give us a little overview, because you had written letters, and I have received those letters about the critical nature of those early stages and the lack of response that really concern you as the president and CEO.
Yes, Governor. We began writing letters to the governor and to the director of the Department of Health back in March. And there was a period, probably 8 to 10 weeks, we were sending one letter a week expressing our concerns. Sometimes it was a lack of PPE. Sometimes we expressed a need for staffing help prior to the virus hitting the state. We said, we know this is going to be an issue. And when it hits the state, it's going to hit more than one home. All of our homes have crisis plans in place. They have disaster plans in place, which would involve a major illness outbreak. It would involve what happened last night, homes that may have lost power, any type of situation. But those plans usually rely on being able to borrow staff from a neighboring facility or using staffing agencies. But in this case, it wasn't only a regional, but a statewide, but a nationwide problem that we all know. So those plans really go out the window. And we said from the beginning, we're going to need help with PPE. We're going to need help with staffing. We're going to need help at the time the virus hits, because we know some staffers will become ill and can't stay and have to quarantine for 14 days. We know that some staffers will be afraid and don't want to stay on the job. And unfortunately, our predictions were correct. But I mean, it's not like the state had a supply of personnel they could send in, but we outlined issues for weeks in advance and for many weeks at a time. And ultimately, there was a response, but it was just a slow response. I mean, we advocated for testing in our homes. We advocated for rapid testing. When testing went to Twin River and you could drive up and get an immediate test, we said, we need those machines in our homes rather than send staffers who might be on, I know this is a Rhode Island thing, but if you're on Aquidneck Island and you have to drive up to Lincoln to be tested and then drive back for your shift, that's taking someone off the floor for a couple of hours, or it's taking them away for a couple of hours. So there were a lot of issues. There still are a lot of issues, and we will continue to advocate for our members.
Yeah, and so I want to get to the letter that you wrote recently, and because of a letter that was sent by the state, and we're going to put that up shortly. But I think it's very important, Scott and Ashke, for everybody to understand that until there's a vaccine, we're going to continue to be in this spot. So your advocacy here tonight publicly is going to make a difference in terms of the response that the nursing homes receive from the state. And I thank you for being here tonight, both of you, because this is a real important issue to families in every community. I've always said, you know, I was a mayor of one community, Cumberland, and I always kind of give 2 thumbs up when I hear somebody from Cumberland. But at the same point in time, all 39 cities and towns matter, and everybody that lives in those communities matter. And the communities that make up those communities, in this case, the nursing home and the facilities that are caring for those who are most in need, they matter. And I'm glad that you're here tonight, because like I said, we need to make sure that we continue this messaging, because this is not over. As I started the show, the program, this is not over, everybody. We need to keep pay attention and diligent. So Ashke, we talked a little bit this weekend and also earlier before we came on today. I think that one of the front and center issues right now is visitation, and what's happening in visitation in your facility, but also what's happening in visitation around the state, and what flexibility, if any, can we have over and above what we're doing right now, or what do we need to do to create more flexibility is probably a better question.
Well, we are following and we are restricted by Rhode Island Department of Health guidelines and by the CDC guidelines, which they follow. So we are applying for visitation. We schedule families to come. We are having visitation outdoors, and families are coming in on a schedule. In addition to that, we have Zoom meetings and Facebook meetings, and our social workers and employees are going around trying to accommodate families, seeing folks like this, virtual visits. The issue that was foreseeable when these guidelines were announced is that when we do our weekly surveillance testing of our employees, the current guidelines say that if any one employee tests positive, all visitation stops for a period of 2 weeks. And that is operating like a stop-start switch. So we call families and say, you can come, let's schedule those visits. We are setting up tables outdoors. We have the appropriate sanitation, the supplies, the masks, all those kinds of things. We try and make it cheerful. And the tests that were done in the prior week, one employee comes in with a positive COVID test. Now we have to call the families and say, the visitation that was scheduled for Friday and Monday, we have to push this all back 2 weeks. While there is good reason for the start-stop switch, The physicians, the epidemiologists have tried to think it out the best they can. It causes angst, and the families are traumatized. And while they're understanding, they're disappointed. And so, at the crux of everything is testing, 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 and rapid results, 2-day results. At this point,
Where are you right now on the testing results? Because this is something that is resonating around the state for not only nursing homes, but also schools right now.
well, as of today, while there is promise of better testing results coming back to us in the future, as of today, we are getting results from last week and in some instances from the prior week. So I've actually had employees give test results, get swabbed. We come to the following week and they're being swabbed, but they have not seen the results from the prior week. And they're naturally looking at us and saying, why are you swabbing us again when we don't have the results from the prior test? So that's happening less and less, but we're looking at 7 days or so to get results. And to me, that's very, very scary. I would like to test the employees, and as soon as I get the results, and one of them is positive, we isolate, quarantine, segregate them, tell them don't come into our building until you're cleared. And that keeps everyone safe. So I've had many a weekend ruined because of the testing results coming in on a Saturday, Sunday, and suddenly I'm told one person tested positive. And psychologically, it's devastating to me. Psychologically, it's devastating to our management because now suddenly the fear of, oh my God, is COVID going through my building again? And I have to communicate to all the families that have had one person test positive, and this has happened and the person's been in the building for about 7 days, maybe.
Yeah, but there is testing in the state that can respond in a 48-hour period, right? There's some people who are getting their response within a 48-hour period.
That's right. When the test results go to the Rhode Island State Lab, they are able to expeditiously get results back to us.
And Governor, on that issue, as you know, because you've received copies of the letters, our organization has advocated for the rapid testing for the 48-hour turnaround results. And it's taken weeks, but Lifespan has put a lab on board. I think it started a week or so ago. And then I believe it's this week, but there are two more companies coming online. Dominion Diagnostics is setting up a location in Quonset to do some testing. And then there's a company, AccuReference, out of New Jersey. And each one is supposed to do about 1,000 tests a day, but they're still not up and fully running. And as a result, we're still seeing situations like Akshay is saying, sometimes 7 days or more to get the results. Now, again, we've been asking for weeks and weeks and weeks. When these 3 labs are fully running, we expect that to help. But this has been going on for quite a while.
Yeah, and
Another point, if I may,
yeah,
very important point. So far, the testing has been paid for by the state, but with these new labs coming on board, Lifespan and the other 2 labs that Scott just talked about, we are being told that we have to collect insurance data for our employees and provide that to the lab. So now the commercial insurance provider is going to pay for this testing. Now just think about it. An health insurance provider going to pay for regular testing every week. What do you think is going to do to our insurance premiums when it comes time for renewal? Going to go through the roof. And that is going to be on the employer.
Yeah, so that's a good segue into the COVID federal dollars, and I think everybody in Rhode Island knows that I've been advocating for those dollars to get distributed as they can be into the small business community. and I'm pretty familiar with all the guidelines. It's not that complicated. But the state could use those dollars actually for those testing and use the funds, the federal dollars, to cover that testing. And it would seem as though that would be a practical thing to do. If it slows down the process to go through the insurance, if it creates an additional cost to our small businesses in Rhode Island, that's what these funds are for. So I would hope that you'll be advocating to use those funds if, in fact, you're going to start bearing the burden of testing in nursing homes where we have it's a critical nature right now to the work that you're doing. But that's a good lead in, Scott. And Ben, could you just put up the letter that I gave you if you have it available? This is a letter that you received, Scott, about 2 weeks ago, I believe, a week and a half ago, and then you CC'd all the general offices. That's how I found out about the situation on this particular instance. The other letters you have shared with me, but talk to me about that letter. And if Ben can just put that up, I asked him to put up the area where it kind of starred, where it indicated that you would have to people would have to sign off on any claims they might have on the UHEP claims in order to get the new COVID money. So I think
Yes.
you used the term, being held hostage, and I think that you were being polite. Some of your members would use even more expletive terms. But tell us about that, and then because that's one of the reasons that I wanted to bring you on is to say, hey, we need to pay attention to these nursing homes in a way where we deal with the COVID epidemic and the pandemic right now.
Well, certainly we've been advocating for more funding for our members. Some federal funding has been received from Health and Human Services, but as you say, there's $1.25 billion in the CARES Act that has come into the state for payment of funds needed to fight COVID-19. And we have advocated for our members. We submitted some information to the state that showed we were going to have losses of more than $100 million or spending more than $100 million on COVID. And we put that forth to the state. The response was, well, there's a fund of $7 million that you can apply for. And we were stunned when there were 11 or 12 pages of attestations that came with it that included signing off on several issues involving UHIP. Governor, I know you're well aware of all the problems with UHIP over the years.
Keep on talking, please.
Okay.
Yeah. My microphone a little bit better.
And we were asked to, if you want this money, then you would need to sign off. And originally it was talking about beds that would be put out of service and they would end up being permanently out of service. It was talking about, as you can see on the screen, slips and segments, as well as applications. And we were just amazed that there would be any conditions put on federal CARES Act money in order for our members to get it. We protested this issue. There were some changes made, but still, as an organization, we strongly objected to the principle of tying anything to it. I mean, if you look at the federal guidelines, Health and Human Services, and interestingly enough, our board chair and I had a call yesterday with the regional director of Health and Human Services, and we brought this issue up with him, and the organization was just stunned that there were conditions applied to CARES Act funding. They told us that the strategy from HHS on a national level was to have flexibility in funding. And they said the plan was to give states flexibility to provide immediate access to address what's going on the ground. And they said, since they're a federal agency, they couldn't directly get involved. But certainly that's why we're making this known to you and to other general officers, to the governor, to the federal delegation, saying, look, we just don't think it's appropriate to tie one to the other. We've been trying to work with the state to solve the UHIP issue since it began 4 years ago. We'll continue to work with the state, Medicaid, EOHHS, whatever it takes to solve these issues, but we don't think one should be tied to the other. Now, the deadline for application for this funding was Monday at 5 o'clock. And to my knowledge, approximately 35, maybe a couple more homes did apply for the funding. And as you heard, we discussed briefly on your Tuesday noontime show, there were some homes that were still objecting to this in principle, but financially they needed the money to continue. They needed it to make payroll next week. So while standing on principle is a wonderful thing. Practicality is several of these homes, or a number of these homes, still had to apply for the money, even though they were opposed to signing off on these attestations.
Yeah, and that's just, it's got to make you just very upset that you would have to, choose. I mean, you still have many homes, right? Nursing homes that have not been settled up with on the UHIP dollars, right? I mean, they
Yes.
still have outstanding applications, and just to kind of reinforce what I just heard and what I know to be true is that for you to access this, for nursing homes to access the $7 million, they had to, in some ways, sign off on any potential claims that they would have coming down the line in the future on the UHIP issues.
Well, some of the claims the state had a list, and part of the attestation is we had to agree to the list they had. And one of the changes that was made was if we had our own lists and we dispute all of these claims, those were not wiped off the board. But that was not clear at the beginning, and our concern was that everything would be wiped off the board, which means that if our home signed off on this, they'd get a little bit of money, but they'd be losing a lot of money, and that was not something anybody wanted to do.
Yeah, and that clarification came after you sent a letter, right, Scott?
Yeah.
Yes, and so that clarification came after the fact, and it's good that they, that was moved that way, but it looked pretty clear to me in terms of what I read and what I talked to some of the people that are in your, very aware of your association, that implication was improved. The situation improved after you wrote a letter, and it still needs to improve more. We shouldn't be putting UHIP and COVID in the same sentence
Exactly.
relative to this issue, and that's why I wanted to ask you. I'm really happy that he's here because he personalized this thing. The work that's going on, we should be doing everything we can to reduce the anxiety, reduce the stress that's in our nursing homes, not to add to the stress. And people, you're talking about hundreds of thousands of dollars in potential claims that your organization still have, and is still outstanding almost 3
Yes.
years later, right? We shouldn't be connecting those two. That's a slap in the face to Ashke and the staff, the people who are doing the overtime, doing all this work, and just adding more anxiety. And also these resources are very valuable because, and Ashke, please weigh in, you're preparing for several months of this type of operation right now. And so
our costs have escalated dramatically. We are running on fumes. We have had some federal help, but that money has to be accounted for and forgiven. It's a loan somewhere along the way. If we meet all kinds of conditions, that money will possibly become ours to have spent. Many of us have already spent it. I just today I'm renewing my insurance on my general liability, my professional liability, and my costs are going up just on insurance by $10,000 a month. There is no provision anywhere to reimburse me for those costs. I had 122 beds, but now with the new requirements that when everyone comes to us, they be isolated in a room by themselves. Essentially, I've taken 30, 40 beds out of service because instead of 2 people to a room, I've got 1 person to a room. They're not paying me for 2 beds. I'm getting paid for 1 bed. So on the revenue side, we've seen significant downward pressure. On the expense side, costs have gone up. We have paid our employees double time, overtime to get them to come into work. And in the middle of all this, I really don't need to be thinking about UHIP. My employees are working from home. We are trying to pay our bills. We're getting paperwork done. We don't need to be drowning in additional rules and regulations at this time.
Yeah. So yes. So look, we could talk on this for a long time. our office and Ashke and Scott, we're here to be advocates for you and also a resource for information. We've done that for literally hundreds of businesses during this pandemic, whether it has to do with the SBA loans or it has to do with the unemployment and DLT, which they've been fabulous, or the DBR. Please stay in touch with us. I don't know, Scott, you want to have give your 30 seconds, parting comment here, and then I'll go to Ashke, and then we'll wrap it up with you, and then we'll get to Deb. But please give us your thoughts. What do we? I guess I would set it up by saying, we know we're going to be living this for a while. What do we? How do we improve things going forward?
Well, Governor, to your point, and first of all, I thank you for having us on again tonight, and we appreciate your advocacy for us, as you always have been advocates for the long-term care community. But it's interesting, about an hour ago, I did a media interview with a reporter that said, well, things were bad in April and May. When did you start to turn the corner and see things get better? And how are things now? And I pointed out that while the amount of illness, the number of people getting sick may have dropped, our members, and Akshay can vouch for this, every one of our members is holding their breath to see what's coming next. The fear is that this is not over. Until there's a vaccine and or a treatment, our members aren't looking at this as being over. I mean, the state may open up, things may change, but in our nursing homes, this is still an issue and still a concern. And one of our members has homes in Western Massachusetts, and he has seen a resurgence in Western Massachusetts in the last couple of weeks and is pointing that out to us. And back in March and April, when they saw a resurgence in Western Massachusetts, it didn't take long for everything to move east and hit our homes. So as a result, our members are doing their best to stockpile PPE, doing their best to keep as many staff on board as they can, because the fear is that we're not done with this. We hope we are, but until there's a vaccine or a treatment, we can't be confident in that.
Yeah, we're months away, Scott, right? We're months away. And so, I would just encourage you to keep advocating, because we don't open up our economy. Our small businesses do not get strong again until we really get this under control. And we know that there's certain populations that are more impacted than others, whether it's in some minority communities or whether it happens to be in some of the age categories that you're dealing directly with. So your advocacy is so darn important to the overall, economic health of the state, as well as the overall physical health of the state. So please keep advocating. Ashke, thoughts? A couple comments coming out, leaving here, and thank you very much for being here. I know you didn't get to your glass of wine tonight, but after this, I think you should go and have a nice glass of red wine. A couple of those is healthy. My doctors tell me that's true anyways. Go ahead.
I just want to say, on behalf of our industry, my colleagues who are working in all the nursing homes across the state, people should understand we are trying our very, very best. I think that goes across the board. We are exhausted. We are running on fumes. We are financially distressed. And we're going to keep at it. I don't care what you throw our way. Nobody's going to stop us from trying to do what we have to do. We're going to look after our residents. We're going to look after our employees. But please don't make our jobs more difficult than they are right now. We need that help, and that help would be highly appreciated. And guess what? We are looking after your parents, your grandparents, your loved ones. We are trying to do the very, very best we can.
Well, thank you to both of you for being here this evening. We'll keep this conversation going. This is a front and center issue. One of the things that we're doing on this program, we're keeping some of the, the front and center issues relative to some of the racial bias out there. We're going to keep that going for the year. This is an issue we need to stay on top of and make sure we're revisiting on a regular basis, on these broadcasts that I'm doing. So it gives you a chance to really voice it, and thousands of people are going to hear it. And thank you for your work, and thank you for your advocacy. And, the message I deliver is, if we got the ability from a state or federal to really double down and help into these nursing homes, we should be doing it now. And so there's more to be done, even though we've done, a great deal, but there's more to be done. That's the role in extraordinary times. That's the role of elected officials, is really to step up and do the work that we need to do. And you've both you built the case of why we should be doing it. So thank you so much for both being here tonight.
Thank
Thank
you,
you.
Governor.
Yep. All right, Ben, again, I'll say to anybody that's listening, either live or is listening, through the tape, you got questions relative to some of the thoughts that were brought up tonight. Visitation, I know it's a big issue, as well as other issues, because we're dealing with those on a regular basis and trying to do the best we can to help people who are living in nursing homes, and also the people who are operating the nursing homes. So let us know in our office, 222-2371. And then you also can email us, and Ben will put that email up, and we'll get back to you on that, on any of the things you ask. Can you bring my friend Deb on? Deb Britton? Deb?
Good
Are you
evening,
here?
Lieutenant Governor.
Oh my God, it's so good to have you here, and I'm going to see you tomorrow. And
Yes.
you have multiple tasking you do, right? Multiple tasking, including
Yes.
working at the Hall of Fame tennis concert sometimes, right?
Yes, yes, indeed. You are correct. Yes.
Yeah.
No Newport festivals this year, but
No.
next year will be better than ever.
Yeah, but you're a volunteer down there. But Rhode
Yeah.
Island Elder Info is, your baby. It's
Yes.
you've started it from scratch. Tell us quickly about that, and then we want to give a little bit. We got a good 13 minutes here, so give us a little overview on what your organization does, and you as the founder of that organization, and then we'll talk a little bit about what's going to happen tomorrow.
Sure. So RI Elder Info and RIElderInfo.com is one of the most comprehensive resources for seniors, caregivers, and professionals here in Rhode Island. It's our mission to empower people throughout the aging journey by providing easy, one-stop access to a comprehensive suite of information. So if you're caring for an aging parent, or you're an older adult yourself, you can find the information you need to make informed decisions. If you're, say, a professional who is working in the industry, there's information and resources available on RIElderInfo.com for you as well. It's our core belief that information is power, and no one should struggle to live a healthy, safe, dignified, and happy life from a lack of it. So we're about getting the information out to people.
Yeah, you're a great information center, Deb, and you are also an advocate to get other information out from, whether it's in the Alzheimer's issues, which you're very involved in, and also any of our memory cafes. You certainly are an endorser of that as well. So
Yes.
It's an interesting group that really dovetails each other on our efforts, right? On our efforts, and that, I think that's to your credit too, is that this is an effort to really educate people as best we can. And what are we going to be educating people about tomorrow, Deb?
Oh, I am very excited about tomorrow. So tomorrow is Calling All Veterans Day, the virtual conference. It's going to start at 10 a.m. On the RI Elder Info Facebook page. It's going to be live streaming. Thank you very much for the help of your office to make sure that it goes smoothly. I've always loved the way that you do yours, and thank you for supporting us with the tech support on this to make this amazing. And it's an opportunity for veterans of all eras to get the information that they need from experts in the state to be able to age independently or assist their loved ones. So if you think about our veterans, we have the World War II groups who may be 80, 90 to 100 years old. Those individuals need information to be able to age independently at home, and may not even realize that their spouses are entitled to benefits. So I'll have someone speaking about that. I will have Providence VA there. I will have Director Yarn from the Office of Veterans Services will be speaking. Dora Hellner Vasquez from the VFW will be speaking about the wonderful stuff that the VFW has been doing since COVID. We will have Rachel Garcia. She is one of the federally recognized veterans benefits expert in the state. Paul Santilli from the Vet Center. And interestingly enough, there's a quiet little resource out there. One of the identified barriers to care for our seniors and for veterans is who can watch their pets, and that includes the active duty military. So you don't necessarily think about how important your fur babies are. So I will be speaking with Amanda Beck from Dogs on Deployment. And it's their belief. I just found this so fascinating. It's Dogs on Deployment's belief that if you're serving our country, or if you have served our country, you shouldn't have to give up your pets in order to serve our country or to get the care that you need. So I've got top experts coming in. It's going to be on the RI Elder Info Facebook page tomorrow at 10, from 10 to 12. We will be starting right at 10 o'clock. Lieutenant Governor, you'll be speaking first. You'll be leading us in the Pledge of Allegiance and the National Anthem. And it's going to be absolutely amazing. We're very grateful to the Lieutenant Governor's office. We're very grateful to the Office of Veterans.
And you disseminate it, you distribute it in a way that's very helpful, Deb. And I would also say to anybody that's watching tonight, one of the ways that you can get the message, even what you heard tonight on with what Deb's talking about, or what Ashkay was talking about with Scott, you can share it. So if you're listening to right now, you can share that to your network right now. You just go and bump a share, you share this broadcast, and then thousands of more people will actually see it. That's how we're getting 15, 20, 30 shares a night as we do these broadcasts. And tomorrow, when we do Deb's, we'll be sharing it into our network, into our, and into our social media. The more who share, the more information gets out there, Deb.
Absolutely. And one of the beauties of what we're going to be doing tomorrow is, yes, please absolutely share it, comment on it. But if you have questions that you need answered, things that you're not sure of, all of the experts are prepared to answer questions in real time. And if by some chance there's a question that they're not able to get to, or maybe it's a personal situation, I'll be speaking to the experts offline to get that information for you and then sharing it back in the comment section. Because the reality is, if a person has a question about veterans benefits or what's available out there, they're not going to be the only one with that question. So it's going to be really important that we be able to share that out there extensively, because I know that there's a lot of people who really need the information and resources to age independently in the community, to stay home for as long as possible. And if you do need assistance, to know what are the resources available to get the assistance that you need. So please share it widely, ask questions. Your questions will be answered.
Yeah, so Deb, tell everybody how they can contact your office if they're listening tonight and somehow they're not able to listen in live tomorrow, but you're going to have it. It's going to be taped. It'll be attached to your Facebook. But first, give everybody the overview of how they can contact you, and also how they can actually watch the program if they can't watch it live tomorrow. It's tomorrow between 10 and 12.
So yes, tomorrow between 10 and 12 on the RI Elder Info Facebook page. It's going to be live streaming just like the Lieutenant Governor's is right now. It'll be on the RI Elder Info Facebook page. If you're not able to watch and you have a question, you can absolutely reach out to me. My number is 401-585-0509, or you can always send me an email, and that's Deb, D-E-B, at rielderinfo.com. Now, I don't claim to know the answers to everything, but I'm going to look for you if you have a question to find the answers that you need. I will do my absolute best to get the information anybody might be seeking. And that's true, of course, with our veterans, but for any elder or any caregiver or professional out there, I will do my level best to find the information that you need.
Yes, and I know that to be true, because you are, you're very, you follow up really well, and that's what we like about you, and that's one of the reasons why we want to support everything you're doing.
Yes.
And so tell us a couple of other things that that besides, we have a couple of minutes here, but besides tomorrow on the Veterans Program, some of the things that are upcoming, some of the things that you're supporting, and also tell us how. Also, inside of that, tell us how this, this pandemic is impacting, the great work that, how it's changed the great work that you've been doing and how you're approaching it.
So it's very interesting. So Calling All Veterans Day was originally scheduled for May 9th at the URI Ryan Center. We were expecting to have 100 different resources, and it was going to last for hours. People would be able to apply for benefits right there on site. And then COVID happened. And I was really hopeful at first that it would die down in the summer. So I thought, well, maybe August 1st. And then we realized COVID's not going away, unfortunately, for a very long time. And there is no way on earth I would put at risk any of my seniors or the caregivers or really anybody at risk for this awful virus. So we switched it over to virtual. I have a weekly newsletter that goes out. And so you can sign up on RA Elder Info for either a seniors and caregivers newsletter, which is content more directed to older adults and caregivers, or for our professionals newsletter, where we discuss different information that might be applicable to our professionals, whether that's CEU events or networking events or interesting things going on out there. If people have events that they'd like to share, you can certainly email those to me, and I'll be happy to share those out with the community. We started about 3 weeks ago. Every Friday at 9 a.m. I'm interviewing what I've been referring to as our Friday Friends, and it's a new show. It is an opportunity to spotlight organizations that are doing really amazing things for our communities, for our older adults, and also the ability to spotlight older adults who are doing some really cool things. You know, it seems there's been a lot of negativity around aging and a lot of ageism that I've seen since COVID took over. And I really am working hard to dispel that. Being older, an older adult, does not mean that you are suddenly, incredibly needy, that you're not still living an absolutely vibrant life. So I'm working to dispel that. I also have it is usually opposite this, but at 7 o'clock on Wednesdays, I hold the community family chat. It's a live Zoom meeting, and it's an opportunity to reduce social isolation and loneliness. A group of folks just join me in a Zoom conversation. And if you think of the way the family conversations take place, kind of like after Thanksgiving dinner, and everybody's, relaxed and enjoying each other's company after Thanksgiving dinner, it's like that, where we're just there to have a good time. It's not structured. It's, we'll talk about the day's events. We'll, talk about a wide variety of things. It really does go all over. So Wednesdays, we have the community family chat. Tomorrow, Thursday, August 6th at 10 a.m. on the RI Elder Info Facebook page is Calling All Veterans Day. Friday at 9 a.m. is our Friday Friends. This Friday will be Lori Marie Prescata from the Mental Health Association of Rhode Island, discussing how COVID has had an impact on so many of us, healthcare workers, families, all of us, sadly, across the nation, and what resources are available. So always looking at, trying to get the information out to people. Coming up in, I believe it's going to be, I haven't set the specific date yet. I will be holding a senior resource fair coming up towards the end of September. Again, it will be live streamed. And the reason we're live streaming is to reduce that potential exposure to the virus. We live stream on Facebook and YouTube because research shows that is where most people get a lot of their information. So we are streaming in both places. When we stream, those activities are recorded and remain on Facebook and on YouTube. They also live on the rielderinfo.com page under our blog. So if you don't want to go to Facebook or you don't want to go to YouTube, you can certainly go to rielderinfo.com and see our interviews and get that information. We're really about sharing the information that people need and want.
Yeah, and you've done that, Deb, and thank you for that work. And your, the program tomorrow, Calling All Veterans, really comes on an appropriate time frame, right? We have Victory Day,
Yes.
Celebrating Victory Day on Monday.
Yep.
I've been asked whether I was in favor of changing the name, which I'm not. I think that, my dad served in the Pacific in World War II, and it's just another moment when, my dad is honored as well as everybody else who served with him. So
Yes.
that's a really important thing. And, I don't think we want to, especially in the time frame we're in right now, where we want to, correct maybe sins of the past or some issues in the past. but we shouldn't be, moving something that is so important, which is recognizing our veterans and the service that they provided to our country. And many of them, many of the people who are, shielded our freedom with their lives. So thank you for doing that with the veterans. You're going to have a pretty good crew tomorrow. And if you have Kasim Yan on, watch out. He'll steal the show. That guy he'll come on with his mask and he'll be stealing the show, but be ready for him.
Oh, I'm really grateful that he's able to participate. He's a hot ticket, and I love a lot of the things that his office is doing out there. It's just amazing. It's going to be great because we have our World War II veterans, we have our Korean veterans, our Korean War veterans. Then we have our Vietnam veterans. A lot of people don't realize that the Vietnam veterans really need to return to the VA healthcare system. When they first came home, they were not treated very nicely or may have been provided misinformation. And the VA healthcare system is working really hard to reach out to them to get them back into the fold. We have our younger, the OEF, OIF, Operation Enduring Freedom, Iraqi Freedom. Now, these are our younger veterans, and they may be caring for their own aging parents. And I don't come from a military family, and I'm not military background, but I feel like if a man or woman signs on the dotted line to potentially die for me, then it is my responsibility to give back to those individuals everything that I can to make their life as easy as possible. And my area of expertise is aging, so we're calling all Veterans Day.
You're doing good, and we urge everybody to listen in, share out the information. And Deb, thank you for taking the time here tonight to give us a little preview of what's happening tomorrow. I'll see you tomorrow at 10 o'clock.
Yeah.
Okay, so powerful messages tonight, and I want to thank both Scott Fraser, Ashke Talwar, for talking about the nursing homes. If you have questions or you need more information, you should really contact our office. And then Deb Burton tomorrow will be there calling all veterans and anybody who's helping serve the veterans. It'll be a good time for them to listen in and share their information. So until we see each other next Tuesday at noon, and then we will also be back here on next Wednesday evening, talking about really the issues that really we should need to have community conversations about. So welcome and thank you for joining in on community conversations with me and the rest of the state of Rhode Island tonight. Stay healthy.